A More Excellent Way Life Center Church proudly presents.
A More Excellent Ways Literally, Financial Literacy Series, proudly focuses this topic on our 65 years and older population during the open enrollment period for Medicare insurance and Medicare insurance supplements. Our Medicare specialist guests are from Bankers Life and Casualty Company in Hurricane, West Virginia. With our guest Edward Casto, with special guest Tabitha Justice.
Hello, my name's Eddie Casto, and this is my good friend Tabitha Justice. We work for a company called Bankers Life. We're making this in conjunction with A More Excellent Way Life Church on the west side to help them reach multiple people in the community. Today we're going to be discussing Medicare and some of the changes that will be upcoming. There's some new programs out there like the Insulin Savings Program. There is a telehealth program and various state and federal programs that are available to folks. And then on top of that, maybe just some frequently asked questions. So with that being said, I'm going to hand it over to my good friend Tabitha, and she will help you from here.
Yeah, because we have a lot of different programs that we're doing, right? I focus mostly on Social Security and Medicare issues. So I'm going to be taking over this video, but you're going to be doing most of the other videos.
Yep.
I'm not just having you hang out just to introduce me. You do have a role to play, right?
I do.
Okay.
I do.
All right, good. That being said, I don't need you anymore.
All right.
So you can just scoot on over. All right. So my name is Tabitha Justice. I have been helping people with their Medicare for a little bit over 6 years now. I do seminars about it all the time. I have thousands of clients that I help with this. So hopefully we're going to go over a lot of the questions that you have, and hopefully you all learn something. I think almost every time I do this, someone learns something. So I'm going to pull up, I put some photos together earlier to help us go through this. Okay. I don't know why I have to do it this way, but it makes me list it like this every time. Give me just 1 second to get these up. All right, we are ready. All right, so this is what we're going to be going over today. We have 4 main topics that we're going to go over. We're going to go over Medicaid. We're going to go over the 2 different types of Medicare that's available, what the difference is between A, B, C, and D, and then state and federal programs. I'm sorry, my handwriting is really messy on this, but you can still read it. Okay, so there's 4 main levels of Medicaid, and I think a lot of people get confused about that. When they hear the word Medicaid, they just think that's it, it's one program, and it's a fit-all for everyone. And that cannot be any more true. When you're transitioning to Medicare or when you're on Medicare, the level of Medicaid that you're on, it makes a complete difference in how your transition is going to go. So the first level of Medicaid is what a lot of people consider traditional Medicaid. That is when you have a low income, you meet the income guidelines, you have asset guidelines. This is what people traditionally think of with Medicaid. If you are on traditional Medicaid, when it comes time for you to go onto Medicare, for the most part, the state automatically will sign you up for Medicaid card and then also a prescription drug card. Important thing to remember from that is just because they are enrolling you into a prescription drug card and just because you're receiving help, it does not mean that is the best program available for you. You still need to have that reviewed because not all medications are covered by every card. For instance, I had a lady who she was on Medicaid. She was enrolled into a drug plan. Her medications were not covered under that drug plan. And when she went to the pharmacy, they said her medications were $1,000. All we had to do was switch her to a different drug card, and her medications went from $1,000 to $5. So it's just something to remember Just because you're on Medicaid, it doesn't mean you don't need to be proactive in reviewing your plans. Okay, the second level of Medicaid is the Medicaid Expansion Act. This came out under with Obamacare. So what this means is you're not necessarily low income, like Medicaid level income, traditional Medicaid level, but you don't have enough income coming in to be able to sign up for Obamacare. So it's a stage in between. Under this level of Medicaid, you can have assets. There's no asset limit. There is an income limit. So you can have multiple cars, you can have multiple houses, you could have more than $2,000 in assets. A lot of people fall into this category, like maybe they stop working when they are around the age of 55 or 60. They don't have income coming in, but maybe they still have a 401k or an IRA or some sort of program like that. This is what falls in under the Medicaid expansion. When you're in this group, you may possibly get help transitioning into Medicare, or you may not. It's kind of a coin toss about where you're going to fall into that. All right, the third level of help is the Medicare Savings Program. There are completely different rules about who qualifies for Medicaid once you go on to Medicare. So sometimes if you go to DHHR and you'll say something like, I want to apply for Medicaid, they will say, well, you can't have Medicaid and Medicare. You can, it just goes under a different name depending. Some people call it Medicaid, some people call it Medicaid Savings Program. They call it lots of different things. The point is you can have both, but the requirements to get that help, they change completely. So you sometimes when you transition, especially if you're transitioning from the Medicaid expansion into the Medicare savings, it will just automatically kick you out. And even though you may qualify, you have to re-enroll into the program. So just because some of you guys have maybe been kicked out of the Medicaid program once you started Medicare, it doesn't mean that you don't still qualify. The fourth level is long-term care. This is you have gone into a nursing home and you have spent all of your income assets and you now qualify for long-term care. That's a completely different and more complicated form of Medicaid. So I want to go over those first three especially because a lot of people have confused, they're either misinformed and told that they don't qualify for them, or they're confused about what that means when they transition to Medicare. Okay, so this is the Extra Help program for 2020. It's going to change in 2021, and I haven't really reviewed it yet. They haven't announced actually the changes yet, but this is a really good idea of income limits, and it gives you a broad overview. This one's for the federal program, for the Medicare Extra Savings Program. It also kind of lists the Medicaid. Also, it's not completely accurate when it comes to asset programs, but it's a good thing to look at. So the important thing that I want to point out is if you are less than $1,100 a month per person, or as a couple less than about $1,500 a month, you qualify for Medicaid, depending on your asset level. And that is something you definitely want to look into, and something Eddie and I are both available to help you with. If you think you fall into that category, we're more than happy to sit down with you and help you look at that program. The next level is where a lot of people in West Virginia fall, and they don't realize that they fall into this category for help. So if you are a single person and you're bringing in less than $16,000 a month And the average Social Security check here in West Virginia is $1,500. So the average person falls into this category if that's all they're receiving. You can get help paying for your Part B premium, about $144, and you can also get extra help paying for your medications, which means you have a maximum that you can pay out of pocket. You also don't have to pay for a deductible. This can mean instead of paying $400 in January for, maybe your Eliquis, which is a very expensive medication, you're going to pay $8 for that medication. So it's something definitely to look into. If you're two people, if you're a couple and you're making less than $2,200 a month, you would also qualify for this. Now, of course, there's asset limits, like maybe if you have 401ks or any kind of savings vehicle, you want to look into that to see if you qualify. Again, that's something that we can help you with to look and see if that applies to you. All right, so there are two very, very different programs available if you go on to Medicare. All right. When Medicare first came out, the average life expectancy was only 65 for a male. So these programs were never intended to be this amazing program that was going to carry you far into life. Same thing with Social Security. Social Security, when it came out, the average life expectancy was only 62. So it's important when we're going through those to see things have evolved. So Medicare, it's not your mama's Medicare. It's not the same Medicare that your grandparents went through. A lot has changed because life expectancy has changed and needs have changed. So it's important that you review the different paths to go down. I forgot to turn that off. What was the right program that was available 5 years ago isn't necessarily the correct program that's available for you today. So let's go through some of the differences. Actually, I'm gonna go back on this one more time. So the first path that came out was Original Medicare. That's just your red, white, and blue card. The next thing that came out in 2005 was the biggest changes. You could add a prescription drug plan, or the Medicare Advantage plans came out. All right, those were the two largest changes to Medicare. If you were on the original Medicare side, we're going to go through, that has a lot of deductibles and a lot of copays. So pretty quickly they realized that was not enough to help people. That's when they came out with the Medicare supplement plans. Those work very much like a puzzle piece. Whatever Medicare does not cover, the supplement will come in and cover, okay? And then you can pick up a prescription drug card. So if you're on the original Medicare side, you should have somewhere between 1 to 3 cards. If you're fully covered, you have 3 cards to go with that. Medicare Advantage plans, those are greatly expanded under Obamacare, and they have only grown exponentially since then. This is a pretty bipartisan support program right now. For the most part, if you are on the Medicare Advantage plan, you only have 1 card, but there's big differences between the two, and now I want to go through into detail the big differences. So Original Medicare, that is a national plan. So for a national plan, there's no networks. If they accept Medicare, then they have to accept you as a patient. Under Medicare Advantage, those are actually county plans. So that goes by networks. What works in one county, what works in Kanawha County may not be the best plan if you live in Cabell County. So you want to look into that and see what has the best network for you. Not all plans have networks. Let's tell you a little tip. The best way to think about those networks is the smaller the price tag of the plan, the smaller the network. the larger the price tag of the plan, the larger the network. So if you're in a plan that, maybe you'll go online and you'll see a $0 plan, what that probably means is it's an HMO, which means it's a very small network. And they will say, hey, look, if you come to these doctors that we want you to go to, we're going to give you lower copays, we're going to give you extra benefits. But if you step outside of the network, you're 100% responsible for the bill. Okay? If you go into other plans, like it could be anywhere above $100, usually somewhere around 140 to 180, depending on the company. Those don't have networks. They have what's called like a passive network. You're still going to have smaller copays, but you can go to any doctor you want to go. And then there's the middle price point, anywhere between, $20 to $90. Those you can go to, you don't have a network, but you have a preferred network. So it's less expensive if you go to one of their doctors in network, and the copays are typically higher than the HMO or the passive network. I know that can sound really confusing, but that's really one of the best ways to look at it is the network. And there's nothing wrong with either network as long as you understand how they work. I mean, I have lots of people in all the programs, and if you travel all the time and you have lots and lots of doctors, an HMO probably isn't right for you. If you only have 2 doctors and you never travel, then you probably don't need a passive network. You're probably overspending on that. So it's just, everyone needs to review for them, not what their neighbor has. Okay, the next big difference is you're never going to hear from Medicare or from your Medicare supplement plan. They just pay the bills. Whereas a Medicare Advantage plan is what's called managed care. So they have an idea that the longer that we keep you healthier, the less money that they have to pay in the long run. So they're really incentivized to keep you healthy. They're going to give you lots of extra benefits, like they will pay for your vitamins or pay for you to go to the gym. They're going to call you and remind you about doctor's appointments. Some people that drives crazy, other people, they love it. It's completely up to you, but it is a really big difference between the two. So it's just something to keep in mind. Original Medicare, if you get anything added to it, like dental, vision, anything like that, it's a la carte, so you have to pay for that. Whereas on the Medicare Advantage side, a lot of that stuff is included. Why? Because again, they want to keep you healthy, and they know that health goes beyond just the doctor bills. So they will include a lot of those extra benefits. All right, under Original Medicare, pre-existing conditions matter. So when you first turn 65, you can enroll into a Medicare supplement plan, and they're not allowed to ask any health questions. On the Medicare Advantage side, there's really no pre-existing conditions for the most part. Before 2021, there were a few, but for 2021, there's no pre-existing conditions that could knock you out. All right, so for Original Medicare, if you add a supplement to it, this is only if you add a supplement, very little copays. You're going to pay a lot more for the supplement, but you have very, very little copays. Whereas on the Medicare Advantage side, chances are you're going to have copays. You're going to pay when you go to a doctor, you're going to pay when you spend the night in the hospital. So there's a couple different reasons for that. One reason that they want copays is it's kind of like if you're on the Original Medicare side with the supplement, you're usually pretty healthy when you first start. So everyone knows you're going to need care eventually. So on the supplemental side, it's almost you can think about it as paying now for care that you will need one day. Whereas on the Medicare Advantage side, it's more you pay as you go. I think that's a good way of looking at it. Another reason is, it's kind of just basic human nature. If you know you don't take your medication, then you may end up staying in the hospital. And do you want to pay the copay for going into the hospital? No, you don't want to pay the copay. So you are incentivized to stay healthier, take your medication, take care of yourself because you don't want that copay. So that's just a good way of looking at the differences between them. All right, so Medicare Part A. Medicare Part A is for hospital stays. If you just have Medicare and you do not have a supplement, your copays you're looking at, most people don't pay anything for Part A. Part A deductible is $1,408. You have a co-insurance. You guys know how that works. You go to the doctor, you get billed for everything. So we just say the amounts vary. Hospital stays, once you pay the deductible, you don't pay anything for the first 60 days. For days 61 through 90, you have a $352 a month copay. I'm sorry, a night copay. For day 91 to 150, these are lifetime days here. You pay $704 per night. After 150 days, you're responsible 100% for those charges. Why? Because Medicare does not cover long-term care. That is a huge, huge misconception. People assume I've been paying into Medicare all these years, and now that I need it, it doesn't cover it. Yes, Medicare does not cover long-term care. They do cover skilled nursing with rules. So for skilled nursing, the rule is you had to have spent the night in the hospital 3 nights first, and then you go straight into the rehab center. So let's say Eddie and I are married. Eddie spends 3 nights in the hospital, and then they say we want him to go to rehab, and I say, no, I can handle it. I'm going to bring him home. Once I get him home, and then I say, this was more than I can handle, I can't do this, it's too late. I've already given up the option of going to rehab. You have to go straight from the hospital into rehab. So the first 20 days under those circumstances are covered. Day 21 to 100, those are not guaranteed. You have to qualify for those days, so you have to show improvements, and it is very hard to meet the criteria. So do not, again, just assume that Medicare stops paying after 20 days because so many people fall into this category. You really want to make alternative plans. After 100 days, even if you are showing improvement, Medicare stops paying. There's no way around this. So if you have a supplement, for the most part, all of these copays are covered. You don't have to worry about any of them. If you have a Medicare Advantage plan, these plans are changed around, they're so different, but for the most part, you're looking for smaller copays to go with the Part A. So Part B is what covers your doctor bills and your doctor visits. For most people, you pay $144 a month. They have not announced what's going to be in 2021 yet. If you are low income, remember I went over those earlier, over the different guideline levels. A lot of people qualify for this, and they have no idea they qualify for it. So if you're lower income, that $144 is paid for you through the Medicare Savings Part B program. If you are high income, you have to pay more. The true price of Medicare Part B, somewhere around $480 a month, and everyone beneath certain income guidelines get a subsidy. So most people get a subsidy and your leftover amount is $144. You have an annual deductible every year, and again, this increases every year. It is currently $198, and then you have co-insurance of 20%. If you have a supplement to come in, the supplement is going to cover that 20%. If you were 65 before January the 1st of 2020, you may be able to get a plan that covers that annual deductible. If you're transitioning into Medicare, as of right now, there is no way to get that deductible covered. This is probably, I know that sounds a little bit confusing how that works, but those are the basic payments that work with Medicare. Every year you get your Medicare and U-Book. I do want to kind of briefly go over this because in all the years I have been doing Medicare, this is when I get the most phone calls. So this is a really misunderstood part of Medicare. Especially children are really, really angry when they find this out. But if you go under page 49, this was for the 2020. I don't think they've sent out the 2021 book yet, but you can see what is not covered under part A and B. And that's dental care, eye exams, dentures, things like that, and long-term care. Long-term care is not covered. It says on page 50, you have to buy your own long-term care plan, or you have to prepare for it, or you have to pay out of pocket for it. So I just want to emphasize you do need to make plans for long-term care because it is not covered under Medicare. Only rehab services are. So what that means, if you have someone with dementia, a lot of people with dementia are extremely healthy, but they need care. That is considered custodial care. And you can see right up here, custodial care is never covered, ever. It is only rehab services. So I want to go over this one more time with the different levels of extra help program. If as a couple, if you are less than $2,200 a month and you are not getting any help with paying for your Part B premium or paying with these medications, you definitely need to contact us. If you're an individual less than $1,600 or right around $1,600, you definitely want to contact us. I'm going to get out of here and Eddie's going to come back in and we're going to go over some of the new programs that are available for 2021. I just wanted to go over some of the basics. Eddie's back.
Thank you, Tab. That was awesome.
Let me get close to you, get us both in here. So some of the programs that are coming up, a lot of, remember how, so I was talking about Medicare Advantage plans and how they incentivize you to be healthy, right?
Yep.
So some of the really big stuff that's coming out for next year is and there's certain criteria for these, but some of them are paying for dentures. Mm-hmm. That is like ridiculously big for people because dentures are really expensive.
Yep, it's growing too.
Yeah, if you can't chew your food properly, that's going to affect your health, right? If you're uncomfortable with how you look physically because you don't like the way your smell looks, that's going to affect your mental health, right?
Yes.
So if you're depressed and you have bad mental health, is it possible then that it's going to negatively affect the rest of your health?
Absolutely.
Yeah. So dentures is one thing that's being covered under several plans this year. Hearing aids is something that's covered, which is mind-blowing that it's not just basically covered, right? Hearing is kind of important,
yes,
but yeah, but that is traditionally not something that's been covered under Medicare. Some plans are coming out with gift certificates monthly gift certificates to where you can go grocery shopping
Yep.
and buy food.
That's huge.
It's so big. Some of the plans come with things, over the counter stuff. You can get, and again, it's with the idea of increasing your health.
Mhm.
So you can get pillows, you can get vitamins, you can get Fitbits, you can get toilet paper, any type of thing that you can get like out of Walgreens or something.
Yeah, I usually tell people if you can find it in a pharmacy area
Mm-hmm.
at your Walmart or your local store, then it's going to be in the catalog.
Yeah.
It's huge.
Yeah, I mean, it's really, some of the plans you can even go straight to the store and pick them up. I mean,
Mhm.
it's just an amazing benefit. So they have rolled out, now this has been something that's been a lot of plans, it's been included, but because of COVID, it has massively expanded, and that is telehealth.
Mhm.
A lot of telehealth, so that's where you just pull up your iPhone or your tablet or just regular phone, and you have your appointment over the phone instead of in person.
Yeah, that's really big for the people that can't get out of their house, or maybe they're just too scared to go out, or maybe the doctor's office was shut down for a while. So
Yeah.
a lot of folks out there, they need contact with their doctor pretty often. So that's big time.
Yeah, I didn't have this on my list to go over, but you just reminded me on something. A lot of plans are also offering telehealth for mental health, because a lot of people are depressed right now. They have a lot of
Being stuck in
anxiety.
home. Yep.
Yeah, and almost all of these appointments are being offered with currently, I don't know what next year is going to be, but there's no cost to them,
Mhm.
because again, it's with the idea of staying healthy, right? So if they know people are currently experiencing a lot of mental health issues, it just kind of makes sense that they are going to incentivize you by free appointments to have mental health appointments,
Mhm.
right? So they're also, some of the plans are providing transportation to doctor's appointments. So one of my favorite programs that, and not all plans have these, you have to look at, Eddie and I will look into them for you if you have questions about it. But one of my all-time favorite programs is, they are paying you through gift cards to volunteer. So volunteer is considered a social activity. They want to increase your social activity. And if your social activity is to make me happy by you volunteering for me, that increases my social activity. So they are giving you gift cards for that. If you exercise, it's a way to get gift cards. There's so many different programs available.
That's one of the main ways that I explain these types of plans is they're basically giving you money to take care of yourself.
Yes.
And it's awesome.
Yeah. I mean, they're just really amazing. We should talk about the insulin savings program.
Huge for this year.
Yeah. I helped a person last week with it, and it saved them, because it's a husband and a wife. They are both on very expensive insulin. It saved them $700 a month.
Mm-hmm.
That's crazy.
Yep, I've come across a few of my clients that were, spending $450 or higher in insulin, and it's really helped them out too. So so it's really been a big program.
Yeah, some important things to remember is, first let me give an overview of how it works. So it's not every insulin. It is certain insulins are covered. We would have to look at it's a pretty decent list.
Yeah, it is a good one.
Yeah. And it's a $35 copay per month, or $105 copay for a 3-month period. It doesn't matter what period you fall in. Like if you're in the deductible period, traditionally you have to meet the deductible before you get your copay. It doesn't matter here. you don't have to pay the deductible. It's just
Right.
$35. If you fall into the donut hole, traditionally that price will go up. You don't fall into the donut hole. That being said, it still counts towards your donut hole.
Yes.
So it could still affect your other medications. So it's important to look at that.
Yeah, if you're on other specialty medications,
Yeah.
that could get expensive.
Yeah.
And tiers 1 and 2 probably not going to be affected too much once you hit the donut hole, but other specialty medications. So that's something we would definitely look at.
Yeah. Don't just go with the assumption, well, I don't have to worry about donut hole anymore, because it could, your insulin will be protected, but it doesn't mean your other medications are going to be affected.
Right.
Not all plans cover this. There's not a lot of plans that cover it. So expect some give and take for it. For instance, maybe, remember how we were talking about HMOs kind of cover smaller networks, but you have greater benefits.
Yep.
You may have to move from a PPO to an HMO, or maybe you have to move from, traditionally your plan is only $20 a month. You may have to move to a plan that's $60 a month, or not. I mean, it's just expect to look into it, do a little bit of research, and possibly make some adjustments for it to fit for you. Right?
Yep.
Yeah.
Yep. Once you start looking into that stuff, you'll be able to, lay them out and compare apples to apples and say, I really need this, so it's not going to fit me, or I can do away with this benefit to make sure that I'm saving that money monthly. So like you said, it's a push-pull, give and take type situation. We just have to sit down and see what the best fit is.
I mean, if you have all the money in the world, and then maybe it's not a big deal for you. But for most people, you have to make some give and take. Right. And you and I are happy to sit down with anyone who wants to look into it.
Yep.
I think for the most part, that covers the different, we have the state program of Medicaid and the Medicare savings. We have the federal program of the Part D extra help. The Part D extra help, that's the easiest program with the highest income brackets. Medicaid and the Medicare savings programs, those take a little bit more work. You have to fill out more paperwork for those.
Yeah. We've done quite a few of them, so that's something we can help with too.
Oh yeah, and it is so common in our area that people qualify for those and don't even know it.
Yep.
So we covered state and federal programs. We covered the differences between Medicare Advantage and traditional Medicare, right? We went over kind of how a Medicare supplement works compared to Medicare Advantage. And then kind of the changes that's coming. And I know, just because I'm going to throw something in right now, most of this, once you turn 65, the majority of income is reliant upon everything with Medicare is reliant upon income. And most seniors' income is basically Social Security. You should have that looked into, because, we've came across a lot of people who actually should be receiving more in Social Security, but they didn't
know it.
Yeah.
Or they applied in the past and got denied, and regulations have changed, and so they don't think they still apply.
Yeah, I mean, Social Security disability is something a lot of people qualify for. Maybe before they were filing off of their own record, but since then, either they can get spousal benefits, or a spouse has passed away, so they actually can claim higher amounts. Lots of different things.
Yep.
So I think I'm good on my end. Are you good on your end?
I think we are.
How to contact us.
Yep, I was getting ready to touch base on that. You can reach me at 304-546-0041. That's my cell phone number. I'll answer that most any time. If I don't, I may be in an appointment, so just leave me a voicemail. My email is edison.casto@bankerslife.com. That's my work email, and I answer those within 24 hours usually. I've also got some cards at the church, so if you're around the church and just want to pick up one of my cards, my contact info is on there also.
My phone number, you can text me or call me, 304-881-1366. My email is Tabitha, tabitha.justice@bankerslife.com. Can they text you, or do you want phone calls?
Yeah, text or call. Yep,
Yeah.
anytime.
So I know for myself, and I'm sure you feel the same way, if you're watching this and you do have questions about AEP time and possibility, don't wait. My schedule's really full.
They will fill up fast.
Yeah, I think a lot of people think, oh, I have until December. Okay, if you're thinking that, there's probably 150 other people thinking that.
Yep.
And then everyone, they're like, I didn't get an appointment. I need an appointment.
December 3rd, they start texting and calling.
Yeah. And we're exhausted by then, and you don't have the freshest mind at that point.
To say the least.
Yeah, so the sooner, and if you're wanting to see if you qualify for some of this help, it's not an overnight process. So we need to start long before the last day of AEP. The sooner you get in contact with us, the better it is.
Yep.
So, all right.
Thank
Bye.
you.
Thank you.
We thank our friends Bankers Life and Casualty, Hurricane West Virginia, and our guests, Edward Casto and Tabitha Justice, for their timely presentation. Remember, the Medicare 2021 open enrollment period is from October 15, 2020 until December 7, 2020. For our Medicare eligible family and friends, you have a little more than a month. Please start soon. The traffic gets heavier and heavier, wait times longer and longer. Don't miss out on possible cost reductions, increased services, most importantly, some form of healthcare coverage. Disclaimer: A More Excellent Way Life Center Churches, literally, Financial Literacy Series is not affiliated with Bankers Life and Casualty. Please direct questions regarding Medicare to the specialists.